Okay, Citizens Eye here at the fantastic Aylestone Hall this afternoon, and I've got with me Margaret Ince of Leicestershire Kidney Patients Association. Afternoon, Margaret.
Good afternoon.
Can you tell me a bit more about the association?
The Kidney Patients Association, all members who go to Leicester or the satellite units who have kidney disease, and relatives and friends are members, can be members of the association. The aim is to support members who need help, to provide advice, but also to support the hospital through provision of facilities that the general funds don't buy. We will give grants to our patients too.
Yeah. How long has the association been running?
Now, I've only been here about a year, and I'm trying to remember whether it was, I think it was the early 70s or 80s. I'm trying to remember. It's on the board behind me.
I'll have a look at it. So it's got a fair history to it.
It's got a fair history, that's right. But it has gone through a dip, and it's now picking up again, which is good.
Yeah. Do you think it's important that more awareness is given to sort of like kidney disease?
Yes, I mean, even as a kidney patient, I'm surprised when I went to Leicester. I used to go to Loughborough, and I was surprised when I went to Leicester just how many more patients there were. Yeah. And the fact that some of them travelled from Peterborough or from Lincolnshire, all over. So people need to be aware that people may look fine, but kidney disease isn't very apparent. And one of the other main things, of course, that people need to consider about is putting themselves on the donor transplant list. I have a particular interest, as I actually had a transplant 3 months ago, but mine came from my husband.
Well, we were discussing earlier, you've been married for 40 years,
40 years last week.
Well, what a perfect present.
Absolutely brilliant present, because couldn't ask for anything more.
And how's it been going since?
Been brilliant. I mean, my husband's fine. He shifted a ton of gravel last week, so he's doing very well. Yeah. I'm doing very well. I'm really good. I'm up to 100% kidney function, and I haven't any major problems. A few niggles, but nothing major. I've been very fortunate. And somebody's looking after me, apart from my husband, of course.
So, obviously, after the transplant, have you really noticed a major difference in your symptoms?
Once I got over the anaesthetic, I noticed immediately I felt better. People don't realise when you've got kidney disease, you're not just tired, you are absolutely exhausted. Yeah. You know, and walking a short distance is awful, and you have this permanent feel across your head. And within 3 days that had gone, and I feel like I felt 10, 20 years ago. It's amazing how different you feel inside yourself. Yeah. And people say, I look younger again, and I've got a much better colour. I look and talk more, apparently.
You're doing all right so far. So, can you tell me a little bit more about how people might get involved with your association?
I mean, obviously, if you're a kidney patient, we're there to support them, but we do need more people to help at stands like this so we can raise awareness about kidney disease and about the requirements of patients. We need people to possibly raise funds for us so that we can support people, such as we have a lady whose husband was, well, in fact, was dying, and she couldn't get over from Lincoln, and so we paid for the taxi. Yeah. So it's those sorts of things that our funds are important in supporting. At the moment, we're looking at a grant for a man who has got all his dialysis stuff in his lounge in his hall, and he needs a shed in the garden, and it's that sort of support that we can give to patients. And if someone can help liaise with the man, that would be a benefit.
Do you think it's important that people with experience of a disease actually pass on their experience and help to others?
Yes, because it's been amazing for me, because going through the transplant, one of the other members actually donated to her husband, and it was brilliant listening to her. And I know when I've been going to clinic, there have been people sitting going through the process I've been, and they've talked to me, and then I've seen them again at clinic after the transplant, even in that 3 months since I had mine, and they said it was really helpful to talk to somebody who'd been through it. It makes a lot of difference.
Well, you've obviously done really well today, because the stand apparently was packed with information and it's now gone today. So
yes, no, it's been brilliant. It's a fantastic day, and the turnout's marvellous.
And we must say a big thank you to the women of the Aylestone Bowls Club.
The Aylestone Ladies Bowls Club have been brilliant in inviting us and supporting us, and it's marvellous what they're doing here, and I just hope that, you know, they also benefit from this day.
Yeah, good. So I think Margaret, the sort of things to take away from today is for more people to sign up for the donor register and to give more funds to you.
Yes, but also be aware that kidney patients might look fine, but in actual fact they might not be feeling fine.
Margaret, thanks for the interview today and good luck with everything.
Right, thanks very much.